Buenos días, muchas gracias a Conacyt, a todos aquí. Soy periodista para New York Times. I was just trying to make Fred look bad there. That's the rest of it. I had to get in a few more Spanish words. As science continues to develop at such a breakneck pace, and the more you can do to tell these stories, the better. So I'm going to, as a writer, I'm going to talk a bit about my experience at the New York Times, how we choose stories, how we go about finding out information for stories, and how we think about kind of creative ways to tell stories. And one thing that I always keep in mind is that at the root, at the heart of every story we write, there are real people. So you're writing about science, you're writing about medicine. I write a lot about medicine. And there are always going to be people who are affected by what you're writing about. And I try to keep those people in mind, and also pay a lot of attention to our readers and what their interests might be. And as you might imagine, the readers of the New York Times are not shy about letting us know what it is that they're interested in. And so I thought I might start by sharing a little bit of some of the communication that I've received from readers. Here's one email. Since you are so interested in medical science, why don't you do an in-depth study on the zapper? I know for a fact that this cheap little device works well and is designed to kill all viruses, including HIV/AIDS, herpes, cancer, leukemia, etc. Are you willing to do the story, or are you going to chicken out too? I sincerely hope you can show a little bit of nerve by showing the zapper in the New York Times. Go for it, or chicken out. Have a nice day. So I like a challenge, and so I looked it up. Now this is the zapper. I think it's easy to see how it can be used to cure cancer. And this one, I like this one because it has an angel on it, which I think this is because in randomized, double-blind, placebo-controlled trials, it also not only cures your cancer and your herpes, but it absolves you of all your venial and your mortal sins. So we're going to do a 5-part series on this coming up. But, you know, not every reader bothers to say, have a nice day. That was a nice touch. Especially, I found readers who like their science mixed or mangled, as the case may be, with politics. And we get a lot of those. And here's just a couple of examples. This one, the subject line was homosexuality preventable, treatable. And the writer went on to talk about what a fraud and a scam homosexuality was, and it was all the fault of journalists who were writing about this stuff. And I was really just grateful that the subject line wasn't journalism preventable, treatable. But I didn't reply to that one. Some of them I do reply to. But, you know, people can find a political angle in just about anything. So this was a story that I did. It's hard to figure out how this could be seen in a political manner, but this was a story about the world's oldest leather shoe, the discovery of the world's oldest leather shoe. And this reader wrote, "Maybe I'm too easily offended lately, but this sentence stuck with me from your article about the 5,500-year-old leather shoe. It could have fit a small man or a teenager, but was most likely worn by a woman." That's what I wrote. Why is a shoe by default belonging to a man? Why not? It was most likely a woman's shoe, but could have been worn by a small man. Crazy, huh? Women wearing actual shoes. What's next? Cows wearing sweaters? So we get all manner of things. And of course, you know, I'm picking these for their entertainment value. We get a lot of emails that are very serious and raise good questions and give us good ideas and are very thoughtful. You know, why else would the Chinese and the Syrians been hacking into our email accounts in the last few months, if not to read all of these things? So, as these notes suggest, I have a pretty wide-ranging portfolio. I write mostly about health and medical subjects. I do some stories about biological or anthropological subjects, and because I'm a musician, I write a little bit about the science of music when there are sort of good studies out there. But as I said in the beginning, what I try to do whenever possible is show how the science is relevant to real people. So here's an example. I was asked to do a story about a study on body mass index. Do you all know what that is? It's a ratio of height to weight. And the study found that people who have sort of an overweight body mass index have a lower risk of death than people of normal weight. So that's kind of surprising. But it also raises some questions, which is why would that be? Are there times when a little extra weight might be helpful? Or maybe body mass index isn't really a very good indicator to look at health and death. Maybe there's some problem with the measurement. So I decided to try to tell that story not just by writing about the study, but by talking about the case of a woman named Elsie Scheel, who in 1912, I just happened upon a story about her that was written by the New York Times in 1912. She was pronounced the perfect woman, health-wise. She was never sick a day, not a blemish on her. And she weighed 171 pounds and was 5'7" tall. So she would have been decidedly overweight, but yet she was considered the perfect woman then. So I pulled her death records, and I tracked down her grandchildren, and I dug up some old newspaper articles about her perfection. Here's one. Now this one compares her to the famous Venus de Milo statue. It's not, they actually liked the Venus de Milo better, the people who wrote this article, but they did point out that at least Elsie Scheel had arms, so that was a good thing. But it turned out that Elsie Scheel lived to be 90 years old, which you might think, okay, that proves that maybe weighing a little bit more is healthy. But when I sort of, looked into her background, her long life really had a lot more to do with the fact that she had this very confident personality and a very healthy lifestyle, very energetic and athletic. And so I saw telling her story as not only kind of an entertaining way to talk about what could be a sort of dry subject, but also to say, things are more complicated than this. Maybe we can only take these indicators so far, this body mass idea. So, now, one of the rules that I set for myself, which I would advise anybody going into this writing, is to be careful to say what the limits of scientific knowledge are and what science doesn't know yet, because science is always an evolving discipline, and often 2 steps forward, 1 step back, and at any point there are going to be questions that remain, right? So here's a sort of fun example. I was asked to do a story about a cat named Holly who got separated from her family when they went on vacation in Florida, and somehow she made the 200-mile journey back by herself. So I was asked to talk to scientists and figure out how could this have happened. And basically my story said, they really have no idea, because people were speculating, did she navigate by sound or by smell or magnetic fields, because different animals are shown to do that, but nobody has actually done the randomized study where they let a whole bunch of cats loose and see how long it takes them to come back and which ones make it. That's not exactly the kind of thing you're going to get funding for. So my story was kind of about these colorful examples where people say it's happened before, but nobody really knows. Although, when the story ran, I did hear from a woman who called herself a cat communicator, and she said that really all I would need to do is talk to Holly and get her to tell me how she did this. So I'm a little embarrassed because I obviously didn't do good enough reporting on that story, but there's the next time. So many of my stories, although I have a broad range of things that I do, these days many of my stories fall into sort of two broad categories. So neurological science, cognitive science, mental health issues, and then the area of reproductive health and hormones and sort of the science of gender. So my editors like to say that basically I write about the brain and I write about sex. You know, what else is there? I'm going to talk about how we did some stories in both of those areas, but I was trying to figure out which to start with, so I flipped a coin, you know, heads for the brain and tails. Start with the brain. So this is a story that I did this year. This is the kind of story that I really value being able to do, because it's something that I just kind of happened upon. It surprised me, and I said, wow, if that's true, there's a lot more here. So the story was about why people with mental illness have such high rates of smoking. It's much, much higher than people without mental illness, at least in the United States, and I think this is true elsewhere too. And this is a very sensitive story, obviously. There's a lot of stigma attached to mental illness, a lot of secrecy. It took me off and on reporting, while doing many, many other things, about a year to sort of find the right people and the right places to go and be allowed to go in. But ultimately what we were able to show was that psychiatric hospitals had for decades basically been using cigarettes as rewards for patients, giving them cigarettes if they took their medication, giving them cigarettes if they behaved according to the rules. And so our story had letters that doctors and psychiatrists at hospitals had actually written to tobacco companies asking them for free cigarettes for patients. I went to a hospital in Louisiana where a state law required mental hospitals to allow smoking. I found a hospital in New Jersey, a private hospital, where they were aware of this problem, and so they had banned smoking. This was like 5 or 6 years ago, but then they found that they were losing patients because they were going to other places where they allowed smoking, and so now the hospital reinstated smoking. And so you talk to the staff there and they say, yeah, we know that people with mental illness die 25 years earlier than the general population, often from smoking-related diseases, but this is how we need to allow smoking to keep our services going. And then I visited a man in San Francisco whose case really, I think, underlies the complexity of this issue. And there's almost always complexity when you're talking, and nuance, as Fred said, when you're talking about science stories. Because he has schizophrenia, and the nicotine in cigarettes helps his schizophrenia in some ways. But the other chemicals in the cigarette smoke kind of burn up his schizophrenia medication and make it work less well. So that story got a lot of reaction and really started a conversation, and it was very rewarding. A more kind of hopeful, I guess, brain-related subject that I've written about recently is technological efforts to try to develop systems that can allow blind people to see. So I wrote about one device which is sort of like there are electrodes implanted in the eye, and the blind person wears sort of an eyeglass camera and a video processor, and the system can transmit visual signals directly to the brain, bypassing the eye. So they've had some promising developments with that, and I'm showing this because of the sort of amusing front page layout here. The headline on my story says, "Device offers partial vision for the blind." And they ran it next to a photo of President Obama peering through a magnifying glass, so this is an argument for the beauty of the printed newspaper. It's, you know, it's great to have those kinds of accidents. So many people ask, you know, how we choose what to write about. Obviously, we get inundated with people pitching us story ideas, and there's so much out there, and there's study after study after study. So here's sort of an example of a thing I did. A few years ago, my editor said to me, well, so, you know, is there a line of reporting that you're interested in working on maybe over the next few months? And I said, I was new to the department, and I said, well, how about we look into Alzheimer's disease? And she said, and this response is very logical, I think, and it gives you an idea of the threshold that we have to kind of cross in order to have a story meet our standards. She said, well, you know, I don't think you're going to be able to find anything new about Alzheimer's, because for years we've been reporting that all these drugs that they're trying to treat people with dementia are really not working, or working hardly at all. But she said, you could poke around, which is a challenge for me, so I did. And I did some reporting, and somewhere buried in a mountain of stuff I was looking at, I saw a reference to a family in Colombia. And I made some contacts and reached out to somebody who reached out to somebody, and it turns out that this family is it's a family of 5,000 people, an extended family, and they are the largest family in the world to suffer from Alzheimer's. They have a genetic early onset Alzheimer's disease that strikes very, very young. They start getting symptoms around age 45. So a photographer and I went to Medellin and some of the mountain villages in the Andes, which is where they're concentrated. And it was really interesting. Some of the places that we went told us that we were the first gringos that anybody had ever seen there. But we spent quite a bit of time there. And this is a photograph of these are 2 of 4 siblings in a family, in one family, who have the disease. The woman in bed, Maria Elsie, was about 60 there. She's in the latter stages. She's very, very advanced. The man in the middle, Oderis, is probably about 50 then. He's at a stage where he's starting to get dementia, but he denies that he has it. And so this scientist, Francisco Lopera, who's a Colombian neurologist who's been caring for these families for decades and basically sort of discovered them, he's giving him a test. He's giving Oderis a kind of test, very simple, asking him to repeat some simple sentences like, the boy walks down the street, or oranges grow on trees. But Oderis gets it all kind of wrong, and he says things like, the children walk on the trees. And so you can tell that, you can see the failures. And what became clear to us was that this was not just a story about a family suffering from a terrible disease, but there was actually groundbreaking science going on here, because Colombian and American scientists were seeing this family as a way to take a completely different approach to Alzheimer's research. Instead of trying drugs on people who already have dementia, which had not been working, with this family, they could tell if you've got the gene mutation, you're going to get the disease. And they could test drugs on them 10, 15 years earlier and see if they can, detect ways of slowing down the brain changes and delaying or preventing the symptoms. So we wrote about this, and we're told, partly as a result of our stories, last year this project was selected to get funding from the United States' first national plan for Alzheimer's. And they're going to start testing drugs soon. It's the first time this has ever been done for Alzheimer's, and one of the first times for any genetically predestined disease. So we'll have to see what happens. And when I was talking about storytelling in the beginning, one of the ways that we tried to approach the story, in addition to, we wrote sort of a package of stories. I think it was 1 story and 2 sidebars. But we also did a multimedia project, which was a combination of video and still photos and originally composed music. And I'm not going to play the whole thing, but I'm going to see if I can play a little bit of it. Can we get the sound?
In most of the world, a parent starts forgetting, and the children begin caretaking. But in the mountain villages of northwestern Colombia, there's a ruthless reversal. People are getting Alzheimer's so young. Laura Cuartas has watched 4 of her children get sick, all beginning in their 40s. Laura and her children are members of the largest family in the world to suffer from Alzheimer's. They are victims of a single genetic mutation that has touched the lives of the lineage of 5,000 people. Now she's 82 and a widow. Her husband, who had Alzheimer's, died almost 20 years ago. With the help of her daughter Gloria, she cares for the ones who suffer from the disease. This pocket of sadness...
So I'm going to stop it there. There was actually some dialogue in Spanish in there, but I guess it didn't seem to come through on the... Anyway, after that, my editor was kind of convinced that we had something interesting with Alzheimer's here, and so we've launched, a colleague and I have been working on sort of an occasional series of stories that tries to take, we write when we see something that is groundbreaking or surprising, where the science really rises to the level of good evidence or sort of tantalizing evidence. And they're going to be actually making an ebook. The New York Times is going to be publishing an ebook of some of our work. And for part of that, I traveled to South Korea to do a story about inventive caregiving efforts, including children who are being trained to care for elderly people with dementia. And I spent time in a prison in California where they have such an aging population. They have a lot of patients, a lot of prisoners with dementia, and they can't afford to hire caregivers for them, so they're training other prisoners. These are first-degree murderers who are being trained to care for other first-degree murderers with Alzheimer's. And when we wrote that story, that now a number of other states and city prison systems are trying to copy that. So that was pretty interesting.
Cecil Montgomery was convicted of first-degree murder.
I knocked her unconscious, tied her up, and stabbed her. And I denied doing it for at least 17 years. I killed my sister-in-law.
This program is in place because states like California cannot afford to hire professional caregivers. And people like Mr. Cruz often need care around the clock.
He'll see his reflection in his toilet water, and he'll talk to it, as though it's his brother. He'd think his brother right there in the toilet water. If that cell door is not open, I'm not able to distract him, to get him away from it. And me not being able to get in there, I feel helpless.
Dementia can make people paranoid or confused, and the strict routine of prison life can exacerbate those feelings.
I never take a shower.
Matter of fact, you take a shower almost every day.
I don't take a shower.
You took one the other day.
No.
Yes, you did.
I didn't.
Yes, you did.
I didn't.
I was there when you did it.
All right. If that's the truth, then that's
that's the truth.
Okay, then that's what I have to do.
Okay, here, take your socks off first.
A year ago, I couldn't have said, well, you know what, man, I'm finna go help this grown man, get in the shower, who just, had an accident.
So it takes a lot of effort and patience to get that kind of access, to be able to go and hang out in a maximum security prison and let them, let us wander around. But when we feel like it's important, and it's expensive too, to send a videographer and a producer and me. But these kinds of things become very powerful when you can when you can add to certain stories that way. We don't do that with everything, but we do that with some things. Okay, so that was the brain. Now I guess I should switch to sex here. So, not surprisingly, stories about sexual and reproductive health, they generate a lot of interest. They're very tricky to do. We try to be very careful about how we do them. And we get a lot of really interesting email. So I wrote one story about how men's testosterone levels drop when they have children, and they continue to drop the more actual caregiving that they do for their kids. Our male readers were not thrilled about this story, and this one was one of my favorite ones. And this guy gets to be the front page sort of picture of low testosterone, but so that was fun. But this email said, "This is why I have always refused to do any female work and have many mistresses and girlfriends. Men must be men." So he added a few other things which I'm not going to read here, but I had a lot of fun responding to him. I write some about women's reproductive health issues. So everything from breastfeeding and controversies about breastfeeding and formula to I recently did a story about whether a fetus can feel pain, and if so, when. And a lot of this verges on the abortion issue, which I know is very controversial here and is still very controversial in the United States in some ways. So one question that I was asked to look at was the question of whether the morning after pill, which is a pill that's taken after sex to prevent pregnancy, whether it can disrupt the fertilized egg from implanting in the uterus. So this is an issue that's important in the abortion debate, because people who oppose abortion believe that anything that acts on the fertilized egg, that life begins when the egg is fertilized, and anything that acts on the fertilized egg is in effect abortion. Now, scientists and doctors do not see it that way. They feel that so many fertilized eggs fail to implant in the uterus on their own anyway, and so they start pregnancy at implantation, and this is not an issue for them, but it is an issue that's important to people who care about, who are against abortion. And this was coming up in the presidential debate, and it's still part of the debate over Obamacare, which is the national health law that's just been implemented, because it forces insurance to cover contraception, and some people feel that by forcing it to cover this type of drug, they're basically covering an abortion pill. So my editor said, well, let's go see, is there any credence to this idea that it may in fact disrupt implantation? Because it turns out that it's on the label. It's on the label of the drug that's been approved by the government. It says, usually it doesn't work this way, but it may disrupt implantation. But we were trying to figure out, well, where did that come from? Is there actually science to support it? And it turned out that this was a story that took me several months of looking at government documents and transcripts and talking to manufacturers and talking to scientists and talking to people who were there at the time the drugs were originally approved, that there was never any science to support the implantation effect at all, and that now there are studies that show basically that there's very strong evidence that it doesn't happen. It can't disrupt. You can never say it's impossible in science, but there's very strong evidence that it doesn't disrupt implantation. So that story, as a result of that story, it was interesting because I took a lot of care to talk to people who oppose abortion and listen to whatever studies and look at whatever studies they suggested that they thought contradicted that. And I spent a lot of time talking to the government agency, the FDA, which refused to talk to me at all at first. And then I just kept sending them questions and material and stuff that I was finding. And finally, I got this email from the spokesman for the FDA, and she said, well, these high-level officials, they've looked at all your questions and they've come to the following conclusion. Well, she's not stupid. So I considered that really high praise. And then they followed that with an on-the-record statement, which is, I'm told, really extraordinary for the FDA, where they said, the science doesn't support the implantation effect. Basically, our labels are wrong. I haven't changed the label yet, but a lot of government websites have changed. The National Institutes of Health website has changed. The implantation effect is no longer there. So, one thing that I think is really important to say about a story like that is that when I started out, when I was asked to do that story, I didn't have any feeling about what would the outcome be. I had no dog in the fight, as we say. I was just really interested in finding out what the truth was. And people often ask journalists, how do you keep the kind of journalism that we do? How do you keep your opinions out of your reporting? And for me, it's really not very hard because, of course, I have opinions about things, but it's a much higher goal to me to figure out what the truth actually is, and that to me is sort of the ultimate thing. And I was asked this question at a talk I gave recently, and I came up with what I think is a good analogy, which is that I love chocolate. Okay, I like chocolate a lot, and recently I've been seeing some studies about how chocolate does all sorts of good things for your brain. There was a study that said chocolate makes snails smarter. And I actually drink 2 cups of hot chocolate a day or more and I drink it without sugar and without milk, and it's like really, really healthy. Nobody else likes the taste of it, but I like it. So I would like nothing better than to write, a page 1 story for the New York Times talking about how chocolate makes people smarter. But the science isn't there yet. So I'm just going to keep drinking my hot chocolate, and eventually we'll prove them all. We'll prove them all right. All right. So do you want one more little video? This is sort of a little. Yeah? Okay, so this is sort of a sex-related video, I guess. This is from a story about trying to create condoms that men will actually want to use. And this is a serious public health issue here, right? Because condoms are cheap and they're effective at preventing pregnancy and preventing HIV. And these are huge, problems that cause a lot of suffering in the developing world. But I think something like 5% of men will actually use them. And there are different reasons why. So we started writing about this because the Gates Foundation, the Bill and Melinda Gates Foundation, has started a contest to build a more pleasurable condom. And so we wrote about the fact that a lot of people have been trying to figure this out for a long time, and they've been trying to do things with the fit and the material and the packaging and ways to make them easier to put on and make them glow in the dark. And there was sort of a not very successful effort called the spray-on condom. And then my favorite, I actually ordered one of these because, this was a business expense. The Obama condom stimulus package, which actually had the president on it. Anyway, so this is pretty groundbreaking for the New York Times. It's hard to write about these issues sometimes for the Times because they're very careful about how much vocabulary they will allow us to use, and I've become very good at using euphemisms in describing certain things. But they did they got into this story, and they let us do this video here, which is let's see.
We have ice cream, we have lychee, mango, and even durian flavored that comes from China.
Lydia de Perth works for the United Nations Family Planning Agency, and her goal is to decrease unplanned pregnancies and sexually transmitted diseases like HIV. These are big problems in the developing world, and there are 2.5 million new HIV infections every year.
You're not going to believe it, but this is also a condom.
Ms. de Perth has been trying to offer different designs, flavors, and packaging, anything to make condoms more appealing and fun. She and others have been working on this problem for years, but now the issue is getting some attention from Bill and Melinda Gates. Their foundation is offering $100,000 to $1 million to applicants who can come up with the most promising new condom designs.
What you would find really tasty and might not be something that I would like. So it's really important to understand that we are all, not all the same. Similarly, condoms should be coming only on one type. It has to be a little bit of everything.
The Gates Foundation is looking for something so different and user-friendly that it can actually enhance pleasure. So far, they've had over 500 submissions. They're not discussing the details, but they say people have sent them samples.
In the front we have a piece of leather.
We can be pretty sure that this one, promoted on YouTube, is not a serious entry. Though the slingshot condom may seem impractical,
Fire.
it does raise one key issue. Condoms are annoying to put on.
The packaging part is actually one of the biggest for me, because you have to open it without. You have to be like really careful not rip it or something like that. And so like if there was some way to make that easier and take one hand, for example.
That's true, but then also you have to think about like the packaging has to be strong enough that if it's, I mean things can, but that you won't really perforate it.
Right. Yeah. Exactly. And that's why I don't know how to do any of these things.
Known as this is the world's smallest condom. This is called the hat condom.
But plenty of people are working on the condom use problem as we speak.
Well, the problem with this is it fell off, and then people had to retrieve it. So,
Ron Frazier is one of those people. All right, it goes on a little bit, but that was kind of fun to do. So we're pushing the boundaries a little bit when it comes to these types of things, and it's nice to see because for a writer it gives you some freedom to write about things that really, they really do matter to people, and it's okay to be funny with them, and it's okay to joke about them. It makes people feel more comfortable talking about these kinds of subjects. So I'm just going to, since I started with reader letters, I'm going to end with one of them. So we have really some just delightful people who write in, and this was a story that I wrote about a study that said that the color red, like if you put the color red on in a background or something, it helps you apparently pay more attention to detail, but the color blue makes you more creative. It's an interesting study. So this person wrote in verse, red makes people cautious and more accurate, I guess. Blue brings out the artist and will help to lower stress. Pink makes people titter, and a test group found that green makes a giant jolly but turns bankers very mean. And this went on for about 8 stanzas. Okay, so look, I got to give this guy points for making a big effort, so I wrote back to him in verse. And I'm not going to read my whole poem, but I wrote, well, I am not sure if I've ever received an email quite so clever. I'm guessing when you wrote it, you were in a room with walls with blue. So there you go. You always kind of try to remember the people. Okay, I'll take questions. Is that good?